What was the situation at work during this time?
I went to work, I worked full time. I just had, the second cycle of chemo with the second lot of drugs caused quite a bit of pain. So I was off then at times, but not for very long, so I did work through. I used to go, because I'm a lawyer, criminal lawyer, I used to go to court, but just before I was diagnosed, I started doing an office-based job. I don't think I'd have wanted to go to court.
Why is that?
Because some of the people that you meet at court are not necessarily going to be as reserved in what they say about the way you look.
Yeah. But fortuitously, you changed your role slightly, so you actually didn't have to do that. I
didn't have to, no.
Was there any reaction, either positive or negative, from your colleagues in general? About the cancer and your...
positive reaction.
What did they tend to say?
I think they were upset. But my workplace is very helpful because obviously I'm single, I don't have any family or anybody to go with me to appointments, so my employers worked it so that my friends, because all of my friends are people I work with, had their own rota. They would accompany me to different things.
Oh, your friends came to appointments where
it
could be facilitated. And were the hospital happy with that as well?
Yeah, I mean, you can't take anybody in with you when you go to chemo, because not where I am because the room is too small, but you can have somebody waiting outside for you.
Yeah. So that raises an interesting question about how important is it to gather support during the acute treatment phase?
It's very important.
And did you find the willingness of your friends was like to go to those kind of appointments? Because it's not always clear who to ask and whether they'd be free and whether
I didn't ask them, as I said, it was this kind of, they did it themselves.
Yeah.
So they would work out who was available and free to go to certain things.
What, they actually spontaneously offered?
Yes.
To support you actively through it?
Yes.
And attend with you? Wow, that's quite amazing that they rallied round that way. I sometimes ask people whether workplace colleagues know about the condition, but in your case it shows that if they do know, they have that option to be more involved and to help.
The ones that came with me were good friends. I mean, I've worked there for over 20 years, so they're people I've known for that length of time. They are my friends. But everybody was supportive. I mean, there were a couple of times during the first lot of chemo when I was hospitalised a couple of times with complications.
What complications in particular?
I had a blood clot, and I had an infection which made me neutropenic. So I was injecting myself twice a day. Only in my stomach though, so it doesn't hurt.
How long did you have to stay in for during those complications?
Blood clot only for a day.
Yeah.
Well, overnight while they found out what it was that was wrong. And the infection a few days.
During those periods where you come into the ward, you get exposed to, quite a busy environment with a lot of different types of patients there. Was that something that was quite scary at the time? Because it was fairly new in the process.
Not at all, because it's the oncology wards were very friendly.
Yeah. You found the reception from staff quite warm?
The staff are brilliant. And patients actually very upbeat, positive. I found it quite strangely quite a happy place to be.
Really?
Happy maybe is putting it a bit strongly, but it was a friendly, you felt like you were at home really, kind of.
And did that reflect on your mood as well? Was that your kind of outlook at the time? Were you able to mirror that?
Yes, I think so.
And that probably was helpful for other patients as well, to see you managing well.
I do remember that there was a patient in the bed opposite me when I went in. I think it was the blood clot, and her husband came in and said, "What's she doing here? She looks perfectly healthy, there's nothing wrong with her." It was very rude.
They thought you were too well to be there?
Yeah, I think so. I look too healthy.